You can go ahead and get started whenever you're ready.
Okay, great. Well, I did create some slides, so I'm going to see if I can get screen share to work. All right. So thank you guys. It's really nice that you guys invited me to speak to you. My family has been friends with Rowan Hepler's family for a long time, so it was really nice that she invited me. I thought I would start telling you guys just a little bit about who I am so you know where I'm coming from. So I actually wasn't pre-med until about halfway through college. So you guys are way ahead of me since you are already interested in pre-med. I started out thinking that I would be a sort of more bench research scientist. I loved biology in particular. But as I went through college, I kind of realized it was very lonely for me being in the lab. I really enjoyed speaking with people. And so I switched over to pre-med. To get through medical school, I actually got a scholarship from the United States Air Force because medical school is a little bit expensive. And I did most of my training with the Air Force, the Army, and the Navy. And I actually trained in both family medicine and in psychiatry. I served in the Air Force from 2002 to 2011. That was my obligation for the scholarship. And now I actually still work for the military, but I'm a civilian now. And one of my big roles is actually in medical education. So I am associate professor at the military medical school, and I'm the associate program director for the military psychiatry residency in this area. So I spend a lot of my workday teaching medical students and teaching sort of postgraduate students about psychiatry. So that's a little bit about me, but I want to talk a lot about psychiatry and kind of just starting off with a definition, right? So what is psychiatry? And as a field, psychiatry is the study and treatment of mental illness, emotional disturbance, and abnormal behavior. So as you can imagine, that's a pretty broad definition. There's a lot of territory, right, that you can encompass in that definition. So I thought about, well, what would be like really interesting to hear about psychiatry? Because literally, like, I could talk for years about different aspects of psychiatry. So I thought I would tell you like 3 things that I think are really cool about psychiatry that kind of show you like what's going on in the field right now. And then if you guys have questions or, at any point in time, you guys can just kind of pipe up and ask questions. All right. Let's see. Go back to my slide and make sure it switches over. All right, so hold on. My computer decided it doesn't want to switch slides anymore. All right. So one thing I think is really cool about psychiatry is what I would say is microneurology, right? So it's actually based in a sort of constantly growing understanding of the brain and the nervous system. I also think it's cool. Psychiatry tries to integrate an understanding of the body, the mind, and the social environment. It's what we call a biopsychosocial perspective. And then the other thing I think is really cool is that psychiatry really depends on human relationships. And so I'm going to talk a little bit about each of those things. Right, so this is kind of, I don't know how well the pictures show for you guys, hopefully large enough that you can see things, but these are some pictures that I think are helpful in kind of thinking about psychiatry as microneurology. So neurology, right, is the field of studying the nervous system on the large scale. So what happens if the brain gets damaged, right? If somebody has a stroke or a head injury, what happens if somebody gets an infection in their brain? And this is sort of macro or large scale neurology. Like these are things that if you did a CT scan of somebody's head that you could actually see what's going on. Psychiatry looks more on a microscopic level, right? What happens when the activity in certain brain networks is out of balance? What happens when certain connections are too strong or not strong enough? And so we kind of think of psychiatric disorders as based in the brain and the nervous system on the level of networks and synapses. And the picture kind of on the top right is neural communication. And so this is a picture of some nerve cells, and it, in the blue circle, kind of expands to the synapse. So the synapse is the space between 2 nerve cells, and nerve cells communicate by sending an electrical signal down the nerve cell itself. And then at the end of that nerve cell, that electrical signal causes a release of chemical, which we call neurotransmitter. You guys may have heard just, in different reading or see in the news, people talk about like, depression or anxiety are caused by brain chemicals being out of balance. And when people say that, what they really mean is like the neurotransmitters, at least one of our theories is that the neurotransmitters aren't quite the way they're supposed to be, right? And so those neurotransmitters kind of go across the space, the synapse, and they connect to the next cell. And those neurotransmitters will create a reaction in that second cell. So that it'll cause that cell to do something differently. And that could be generate another electrical signal to like a third cell down the line. It could be changing proteins inside that cell. It could be changing even how that cell is expressing its DNA, right? So we kind of think about neural communication a lot in psychiatry. We also think about the idea of the entire nervous system, right? So psychiatry, we think about the brain, but we also think about the spinal cord. We think about the nerves that go all over the body. And then we think about this idea that all of these nerves kind of form networks, right? So the brain has, we think, about 86 billion neurons. It's kind of hard to count, right? We're not 100% sure, but that's the estimate I've seen most recently. And those 86 billion neurons make 100 trillion connections. And again, those are synapses. So if you can imagine like 86 billion of something, right? And then organizing that into 100 trillion connections, that just kind of sounds like a mess, right? That's a lot. So the brain organizes itself into networks, right? So it's not just 86 billion chaotic cells just doing their own thing. Those cells get organized. And networks are groups of neurons that work together to get a task done. And so what does your brain do for you? It controls memory, right? So if you guys happen to remember our talk or anything that I say, that's your brain and your nervous system at work. It controls sensation, right? So your ability to see and hear, like we were doing on this Zoom call. It controls movement. So as I'm kind of talking to you and I'm moving my hands, because I always talk with my hands, that's my brain at work as well. Your brain also governs your emotions. It governs your decision making, right? So if you get off this call, and I think it's 10 a.m. out where you guys are in California. So if you get off this call and you say, hey, I'm going to go have some early lunch, right? That decision making is coming from your brain. Your brain also controls your hormones, right? So kind of deep in the brain, there are glands that actually sort of overall monitor your body's hormone state and manage it. And your brain also just kind of runs your bodies, like all the things that thankfully we don't have to think about, like our heart rate and our breathing, our digestion, posture, all our sort of reflex actions, like, walking, we don't have to think too hard about. Your brain does all of that, right? And psychiatry is interested in actually in all of those things, like how do all of those things work in terms of how we feel emotionally and what we do and how we think. One of the ideas that I think is really important to understand psychiatry as microneurology is this idea of neuroplasticity. So when I was growing up, that was a long time ago in the 80s, people said, once you become an adult, your brain is stuck, like it's frozen in time, it doesn't change anymore. And actually now we know that that is not true at all, right? So neuroplasticity, your brain changing, actually occurs throughout your entire life. So at certain ages, like toddlers is one example, adolescence is another example. Your brain is going to change more rapidly and more easily, but as long as we're alive, our brains are changing. And that's really a good thing, right? Because the purpose of having a nervous system is actually to safely navigate us through the world. That's what it's there for, right? To help us notice like what's dangerous and get away from it, and help us notice what might be helpful for our survival and go towards it, right? And in order to do that effectively, the nervous system has to learn, right? And every experience we have will change our nervous system, right? And so in the diagram I have over here, it talks a little bit about neuroplasticity. I just thought it was a kind of a neat picture. But the thing I really liked is it said neurons that fire together wire together. And this is a statement that in psychiatry we say all the time. And what it means is that when two neurons fire sort of in sequence, kind of close together because of a particular event, the connection, the synapse between that neuron actually gets sort of stronger, like the cells respond more easily to each other in the future. And the stronger that connection gets, the the more intense the memory is, right? So strong connections form either through repetition, right? So like if you're studying something for school and you say, okay, I'm going to go over it and I'm going to make a flashcard and I'm going to test myself and then I'm going to explain it to somebody else. And, you know, then I'm going to take a break and I'm going to go back to it. I'm going to try to connect it to something else. That's repetition. You're over and over going over that information. And that makes for a stronger synapse and a more robust memory. The other way memory gets really, really strong, right, is if the experience has a lot of emotion behind it, right? So if it's something really important to you, it makes you really, really happy or really, really sad or really, really scared or really, really angry, right? Then that experience is going to create a connection pretty fast, that it changes that synapse pretty rapidly to make that strong connection, right? So neuroplasticity is really the entire basis for learning and memory. And that's something that I think is really cool because we've only known it really for about like the past 25, 30 years. You know, again, when I was growing up, people had no idea about that. And neuroplasticity isn't something that's like a good thing or a bad thing. It just is. It's just part of how our brains are and how they adapt. You know, so what that means is if something really difficult or painful happens to someone, neuroplasticity means that the brain can change in ways that are harmful, right? That cause problems for that person. Conversely, if really good things are happening, right, healthy things are happening, the brain kind of gets shaped around those healthy things. In psychiatry, we use medication, and we use talk therapy, and we use procedures to try to get the brain to make healthier connections. So everything that we're doing, in the end, is kind of designed to kind of work on those connections. And I think one of the things I think is really neat about that is that just by talking to people, right? Just by having a conversation, by listening, and by how we treat people, we actually impact each other's physical brains, right? So that's something that we don't always think about. Hey, you know, we think of the brain as a physical thing and talking is a mental and emotional thing, but actually the things we say and do impact each other on a physical level. And that's something that I try to think about a lot, right? Because it's my job, but it's something I think we can all think about, right? Because what we do and what we say really matters. So when we think about that idea, right, that the things that we do and say to each other really make a difference, that kind of leads into this idea of a biopsychosocial perspective. So that's my second thing that I think is really cool in psychiatry. Psychiatry tries to be very encompassing, right? We want to really understand people's entire experience. So we think about biology, and biology, we kind of mean like all the physical or medical things that could affect your nervous system. So we think about your genes, like what did you inherit from your parents? You know, when we think about genetics, one of the things in psychiatry that's really important is this idea of we're all born with certain sort of personal traits, right? And we call them temperament. And your temperament is things like, are you really energetic and active? Are you always kind of like fidgeting and like have a lot of get up and go? Or are you kind of more like, I'm chill, I'm quiet, you know, I'm more calm? Temperament is also, are you more outgoing, right? And always like eager to talk to people? Or are you more reserved? You kind of sit back a little bit. You kind of want to get to know people first. Your temperament tells you things like, hey, do you adapt really easily to a new situation? Or does it take you a little longer to get comfortable, right? When things aren't the same. And the interesting thing is even really, really small babies will show some of these traits, right? Like, so way before they've learned anything, way before the environment has had much impact on them, babies are showing their temperament. And that's why we think it's primarily genetic. And we also think it's genetic because it tends to be pretty stable over time. So if you're somebody who tends to be more outgoing, you're probably always going to be like a little bit more outgoing. You might, as you get older, be you know, more thoughtful in how you express that, but you're probably always going to be that way kind of at heart. And the same thing if you tend to be like somebody who doesn't really like change a whole lot and surprises. As you get older, you might learn like, okay, not all change is bad and I can cope and it doesn't like make you upset, but it's probably never going to be your favorite thing, right? So you can kind of soften and adapt to those traits, but they're going to still be there. So we think a lot about genetics. We think about medicine, right? So, you know, other illnesses, how those impact your nervous system, the medications that a doctor might give you for different things, like all of those are going to have an impact on your nervous system. We also think about toxins, right? So, and toxins can be a lot of different things, right? So I'm sure you guys have all had lots of education in school about drugs. as a psychiatrist, I would tell you, I think of that as a toxin, right? It's not great for your nervous system. It kind of causes your nervous system to change in ways that produce some problems. But also toxins like what's in your water, what's in the air, right? If we're not taking good care of the earth, we're all exposed to toxins that we don't really need to be exposed to. And those toxins are a problem for us. Some other biological things like sleep, right? Do you get enough sleep at night? Is your sleep restful? Nutrition, like do you have enough food? Do you have healthy food? Do you have all the different building blocks that your brain needs to be healthy and your nervous system needs? And then exercise, right? And I don't know how many doctors you guys have had come speak to you, but I would say pretty much every doctor in every specialty would tell you that exercise is a really important thing for keeping your body healthy. So those are the biological things, and there's a whole lot right there, right? But then we also think about the psychological things. So our psychology is kind of all the things that are in your own mind that will affect your nervous system. So this can be your thoughts, right? So we all have lots of thoughts all the time. Thoughts are just popping into our heads. And those thoughts can be like most of the time really helpful, right? Like I'm remembering this, I'm paying attention to that. Hey, I'm going to go do this. Sometimes those thoughts are a little less helpful, especially if they're sort of mean or self-critical thoughts. So it doesn't tend to be too healthy. But those thoughts actually impact your brain, right? Just like the words we say to each other, like physically can change our brain, the things that we think on a regular basis, right, can actually change those synapses, right, and cause certain connections to become stronger. And the same thing for our beliefs. So beliefs tend to be sort of more than thoughts, but things that we've thought for a long time that we really think are true about the world. Those things impact our nervous system. Memories is another one. So, hopefully you guys have lots of memories, hopefully lots of good memories in your lives. But those memories, when you bring them up and think about them, right, you can probably feel that in your body. Like if I say, hey guys, everybody just think for like 2 seconds about something that really, really made you happy, right? Just take a couple seconds. You can kind of feel like, that sort of lightens your body up. It might make you smile a little bit. And again, that memory is impacting your nervous system. Some other things that as a psychiatrist I think about is defenses, right? And so a defense is kind of something your mind does to protect you from feeling bad. So a really common defense, like have you guys ever been told like, oh, that's a learning experience, right? I think pretty much everyone has been told that. And if you can get yourself to believe it, it's a defense. It makes something that wasn't too pleasant actually seem a little less bad. Another really common defense is, let's say you just didn't get something that you wanted, and then you tell yourself, well, it's okay. I didn't really want that anyway, right? That's a defense. It's your mind's way of kind of protecting you from the hurt. Some other things that we think about in psychology is just attention. Like what do you pay attention to, both outside yourself and inside your own mind? Like which thoughts and beliefs and memories do you give a lot of attention to, right? Which people do you listen to in your life, right? Who gets your attention? And that affects your nervous system. And then the last thing I put in psychology is mindfulness. And that could seriously be like a whole talk all by itself. But mindfulness is something that, again, just maybe in the past 15 to 20 years, people are talking about a lot in relationship to psychiatry, because mindfulness is a kind of mental exercise that teaches you to strengthen your awareness and your attention and to kind of get a better view of what's going on with your psychology. And people who practice mindfulness exercises, it's very interesting because they do like special MRI scans of them, and you can actually see their brains are different, right, from practicing all that mindfulness, which is pretty fascinating to me. And then our last category is social, right? And so biology is kind of the physical body, psychology is all the stuff in your mind, and social is like everything else. It's a huge category, right? It's all the people and all the factors in your environment that can impact on your nervous system, right? So it's your family, right? How do you get along with them? Do you not get along with them? Do you get along with them sometimes? What do they think? What do you think? It's your friends, right? How do you connect with your friends? Do you feel safe? Do you feel comfortable? It's your culture, right? So what does your, not just your family, but kind of the broader culture around you say about like who you are, who you maybe they want you to be, what's good, what's bad, what's valued, what's not valued. Safety is actually a social factor. Like, do you feel safe, both physically and emotionally? We don't always think about that, but that's actually a really big factor that impacts the nervous system, because the nervous system, remember, is there to navigate us through the world. So if we're not feeling safe, our nervous system is always going to be kind of on alert and active, and that has a lot of impacts down the line. Education is a huge cultural or social factor, right? So the fact that you guys are interested in pre-med and can link up with an organization that kind of says like, hey, let's have speakers to nurture that interest. That's an interesting educational factor for you guys, right? That's going to shape your nervous systems in different ways. And then resources, and resources is a really big, broad category, right? But that's, you know, do you have money, right, to pay for things, right? Do you have access to good healthcare? Like, can you get vaccinations, or, you know, if you get sick, can you go to a doctor? Can you get good, healthy food at the grocery store, right? And can you get access to education, right? So all of these factors, we call them biopsychosocial, kind of impact on our nervous system. And that impacts on, again, the things that psychiatry cares about, right? How do you think, how do you feel, and how do you behave? All right, let's see if I can get the slide to switch. All right, so this is kind of still talking about the biopsychosocial perspective. And this is this idea that all of the factors influence all the other factors, right? So we kind of, like, when I was learning about them, we put them in these nice columns, right? And they look separate. But each domain really actually impacts the others, right? So here's an example, right? So we kind of talked about genetics as part of the biology domain, right? But it's interesting because certain genes will impact how we interact with other people and how we think about things, right? So again, that's that idea of temperament, right? If you're somebody who is super outgoing because of your genetics and your temperament, that impacts how you interact with other people and how you think about yourself, right? And at the same time, the ways that we interact with other people, right, are going to shape our neural connections. So it's that psychological, or that social part, is going to then put more pressure back on our biology. And the way we think about ourselves, right, the thoughts that we say over and over to ourselves, actually also influence both our biology and how we interact with other people, right? And so in psychiatry, one of the things we think about is, can I get change in any one of these domains? Can I get this person to do one thing, right, in some way that's going to change all of the domains because I've changed one domain? So again, we kind of talked a little bit about exercise is important. So if I can get someone to exercise regularly, right, they're going to be physically healthier, they're going to sleep better, and those are biological things, right? They're also going to have more brain-derived neurotrophic factor, which is a chemical that your brain makes that kind of supports your brain networks and the health of your synapses. So that's an exercise increases that factor, right? So it's kind of an interesting thing. So if you exercise, those are biological changes. But also we've learned, like, if you exercise, you learn better, right? Probably because you have more brain-derived neurotrophic factor, which makes it easier for you to learn because it's easier to change your synapses, right? But that's a psychological change, right? If you can learn, that's psychology. And also, if you are exercising, you might be more self-confident. You might feel good about yourself, right? Or you might go out and do things with other people. Like, it depends on what your exercise is. And those become social factors, right? How do you interact with other people? So that one change, like getting someone to exercise, is going to impact in every domain. So the biopsychosocial perspective is something that I really value in psychiatry. And then the last thing that I think is really cool about psychiatry is psychiatry is really oriented around relationships with people, right? So it's pretty common for a psychiatrist to work with the same patient for months or even for years. And part of that is like getting the brain to change into healthier ways. It takes time and repetition, right? We kind of said already, like, learning and creating memory, one of the ways you do that is repetition, right? So psychiatrists often will go through the same information and help somebody for quite a while. So you get to really get to know people, right? And the way that a patient and a psychiatrist relate, we call that the therapeutic alliance. It just means, like, are we agreeing? Are we on the same side? Are we both working towards the same goals? And do we both feel that, right? And so a good therapeutic alliance between a patient and a psychiatrist, we think about it being characterized by trust, by respect, by sort of integrity for both people, and also by kindness, right? So psychiatrists should be kind to their patients. I mean, that sounds pretty obvious, right? And usually people who are interested in psychiatry kind of know that already. But sometimes I have to teach people that, like, you have to be kind. And it's really important to have a good alliance between that patient and their psychiatrist, because it's really interesting. That alliance makes a huge difference in whether people get better. So when I give somebody a medication, right, that medication hopefully is going to work on a biological level, but the patient's connection to me, our alliance together, counts for about 30% of what that medication is going to do. That's a lot. That's a third, right? And if I'm doing talk therapy with somebody, right, so I'm maybe getting them to do certain mental exercises, and we're talking through how they think about things and trying to change certain perspectives that they have, right, and trying to get them to work to essentially exercise their brain in healthy ways, their alliance with me, the research says it counts for about a quarter of the effect of my therapy, right? So that's a really big amount of the effect of something. So human relationships are super important. Skilled psychiatrists, I would say, relate to their patients using the attitude of COLE, right? And COLE is an acronym. It stands for curiosity, right? So a good psychiatrist wants to know, like, why are you behaving that way? Not in a critical way, but like a genuinely interested, like, what's going on? Like, what makes this happen in your life? Relate to people with openness, right? So not judging, not kind of saying, well, that's right and that's wrong, or you shouldn't do this, but really just being open. Like, what is your experience? I want to hear it. Also acceptance, right? So really letting this person know you accept who they are, right? You're there to help them. You're on their side. And there's nothing that they can tell you that you're going to be like, nope, I don't like you anymore. I'm not going to help you anymore. And then the last one is loving kindness. So again, that's that idea of just being kind to people and having their best interest at heart, right? And treating them, I mean, I would say the way that I would want to be treated if I was coming to somebody for help. And having this attitude of COLE, right, is really important, not just because obviously that makes people feel better and helps them trust their doctor, but actually there are neurons in our brain called mirror neurons. And those neurons, when we do an action or when we see other people do an action, they fire the same way, right? So like if I pick up my glass of water that's sitting over here and I hold it up and I drink from it, you guys actually all have neurons in your brain that will fire just as if you yourself had picked up a glass of water and drank from it, right? And this is a really fascinating discovery, right? This is kind of like how we see that our brains sort of are mimicking the activity of all the people around us. But that also means they mimic the emotional activity, right? So because of mirror neurons, if I'm demonstrating to my patient and kind of exemplifying these sort of COLE traits, curiosity, openness, acceptance, and loving kindness, hopefully, right, their brain starts to mimic my brain and they start to have those traits towards themselves, right? So a lot of people come to psychiatry, they don't feel very good about themselves. And part of my job, right, is to kind of help them shift what their brain is doing so that they feel better. So those are three things I think are really cool about psychiatry. I don't know if you guys have ever thought about psychiatry. I know that you're interested in medicine, but I would like to leave you with a couple thoughts about, like, is psychiatry for me? So if you're a good listener, right, if you're able to just really hear people, psychiatry might be a good choice for you. If you can be compassionate towards other people's pain, that's kind of an important characteristic in psychiatry. If you can be patient, because change does take time, and things don't always happen fast, so you have to be able to be patient. I think if you're an advocate for justice and fairness, we kind of talked about this idea of safety being really important. If people don't feel safe, that has a huge negative impact on their mental health, and on their physical health. Right? So I think as a psychiatrist, if you're an advocate for justice and fairness, you're kind of advocating for health for all people. Or if you're good at seeing patterns and making connections. So a lot of psychiatry is kind of like trying to figure out, like, how do these things link up? How does this keep happening in this person's life? So how do these connections happen? If you're curious, right, about why people think and behave the way they do. I think for me, that was probably the first thing that really got me into psychiatry, is kind of just wanting to know, like, well, really, like, why are you doing that? I don't understand. I want to know more, right? So that curiosity has been huge for me. If you want to know more about how the brain works, which, I mean, again, I love neuroscience. I think it's very, very cool. And if you love being on the cutting edge of medical knowledge, right? So I think psychiatry is one of the fields that is really growing and changing in medicine, because we're just starting to have the tools to really understand like how the brain and the nervous system function on a really fine level. So I think a lot of things in psychiatry will be growing and changing. I tell my students, I'm like, hey, in 25 years, I hope to be attending a lecture that you give, and you're going to be telling me things that I didn't know 25 years ago, because the science has really grown. So all of those things, if a lot of those things apply to you, then yes, psychiatry really might be a good choice for you. So that is what I prepared to talk to you guys about. I'm going to see if I can figure out how to stop sharing. All right. Thank you guys for listening to me. I appreciate it. Do you guys have questions for me?
Yeah, so my question is, what is the difference between a psychiatrist and a psychologist?
That's a great question, and people ask that all the time. So a psychiatrist has gone to medical school, right? So you guys probably know this already, but after college, if you want to be a doctor, you go through 4 years of medical school. And then you also go through additional specialty training, right? So when I said I was talking about medical students and residents, the residents are the people in specialty training after they've been to medical school already. So a psychiatrist has gone through medical school and has gone through that specialty training. A psychologist goes to college, and then they go to they get what we call a doctoral degree in psychology. So they don't go to medical school, they go to a university. And a psychologist typically is going to learn a lot about thinking and emotions and how those things impact people. They tend to be really good like counselors and talk therapists, but they don't tend to have the medical knowledge, right? So some of the neuroscience and the brain science and the medication science that I have as a psychiatrist, a psychologist might not have. On the other hand, they learn some things that I don't know, right? So they've usually spent more time learning more therapy than I know. And they also have often spent time learning like different ways to test people. So there's different tests that psychologists give to help us figure out like what's going on. I can't do those, like I'm not trained in those, but a good psychologist would be able to do those. So I see one question in the chat. So that's from Rowan. Yeah, that's a really good question. So Rowan's question is the emotional and psychological mirroring applicable to when other people criticize themselves? Like your friend is calling themselves ugly or saying that they hate themselves. Does that affect how you see yourself? I think it probably, like I don't know, I'd have to look up research to know for sure, but my gut instinct is, yeah, I think it does, right? If you're spending time with somebody who's putting themselves down, there is going to be something in your brain that kind of wants to mimic that, right? And you're going to think, well, like maybe I should be putting myself down. Again, I think one of the things I hope you'll take away from this is like how we speak to and around other people really matters. It makes a huge difference. Other questions from people?
Is there anything you wish you know when you were starting out in this career that you like would tell yourself now?
Wow, that's a great big question. I certainly wish I had known, I wish I had known more faster. Does that make sense? Like, I wish I had learned faster, because sometimes I look back and I'm like, I could have done a lot more with that particular person or that, that issue if I had known sooner. I think I wish I had known like some of the things I know now about neuroscience and mindfulness, right? Because those have become really powerful tools. I think, I don't know. I think some of the things I did already know that were important, like I knew that medicine would be hard work, but it would be worthwhile, right? And that's something that I knew, but I would want all of you guys to know too. So I see a couple other questions in the chat. So Nora said, is psychiatry kind of like a more deep kind of psychology focusing on mental behavior and nervous system medically? And are they allowed to prescribe medicine? So that's actually kind of a complicated question. I would say that psychiatry and psychology are very closely allied, and there's definitely similarities. I don't know that, like, a psychologist would probably not appreciate me saying that psychiatry was more deep. we have, maybe think of it as like we're taking different angles on the problem, right? So I do tend to be coming from this very medical neuroscience perspective, but I'm also listening to my psychologist colleagues, and I'm also thinking about how does it matter, like what people think and what people say. You know, it's not, maybe not better or worse, but just different. And we often work together, right? So like my team at work is psychiatrists, psychologists, social workers, and there's a whole lot of what we call allied fields, like groups of people coming together. Are psychologists allowed to prescribe medicine? Actually kind of depends. So some psychologists take extra training specifically to understand the medicines that work on the brain, and they get an extra degree. So on top of the degree they already got, their doctorate, they get an extra degree. So they go back to school, and they go through kind of an apprenticeship program, and then they can prescribe medicine in certain states. Like different states are different because the laws get really weird. So Connie asked, are there any subspecialties? Yes, absolutely. So you can specialize in psychiatry and child and adolescent psychiatry. You can specialize in geriatric psychiatry. You can specialize in what we call consult liaison psychiatry, which is psychiatry for people who are having a lot of medical issues, right? So they're in the hospital with pneumonia, but they're also having psychiatric problems, and a consult liaison psychiatrist specializes in that kind of thing. And you can actually specialize in something called forensic psychiatry, which is kind of cool because it's figuring out like what were people responsible for and what did they know. It's kind of like the intersection of psychiatry and crime. So those are the ones I can think of off the top of my head. Do I know how COVID-19 has affected people in terms of psychiatry? I would say it's been terrible. It's been terrible for everybody's mental health. What do you guys think? Do you agree? Like, do you guys think this? I think this has been awful. I would tell you as a psychiatrist, like I've had a lot more people that I've needed to take care of, and they've all been a lot sicker. Like people are really anxious and depressed, and they feel alone. So Aiden says, would I say that someone who dislikes using medications and drugs to treat people would be a bad fit for psychiatry? I guess it would depend on how much you would say, how bad is dislike? Like, is that like, absolutely not, I would never ever do that. Yeah, you're probably not a great fit for psychiatry, right? You might want to go into an allied field. If you're kind of like, I want to be really careful about medication, absolutely. Like as a psychiatrist, I really want to be sure that if I give somebody a medicine, they really need it, and I'm confident that they need it. I don't think we have much time left. I'm going to answer Sarah's question. Does my psychiatry focus on any...
I know we have less than a minute left, and people do have more questions coming in through the chat. If the meeting ends, we can rejoin using the same link that I sent in the email. And then Dr. Greene, you can continue to answer the questions if that's okay.
Yep, I will join back in if we get kicked out.
Yeah.
So I don't know if I answered Aiden's question as well as he wanted because I was rushing. But again, I would say I've worked with psychiatrists who are not super keen on medications, and I've worked with other psychiatrists who maybe give a few too many medications. Some of my colleagues are very interested in what we call functional medicine, and functional medicine looks at things like nutrition, right? So what kind of diet are you eating, and how does that impact your body, and how does that impact your brain and your brain functioning, right? So there's a lot of different perspectives. I tell people, like when I'm working with students, medicine is a big house, right? There's a lot of room in medicine for pretty much any way of thinking about it. Sarah says, does my psychiatry focus on any age groups or types of people? So I'm mostly an adult psychiatrist. I've taken care of some adolescents, but I would say like 95% of my practice is with adults. Adults for me means anything between the ages of 18